the 30-second technique that stops cavities before they start. 5 years ago, my dental hygienist discovered something that changed everything. Maria had been cleaning teeth for 20 years, but she noticed one patient who never got cavities. Ever. This patient wasn't special. She didn't have perfect genetics or expensive treatments. She was doing one simple thing differently that took just 30 seconds after each meal. Cavities cost Americans over $45 billion annually, according to the Centers for Disease Control. Yet this simple technique could prevent 90% of them. Most dentists don't mention it because it's so basic. Let me share what Maria discovered and why this technique works when everything else fails. It's not about brushing harder or using expensive mouthwash. It's about timing. The patient's name was Helen, and she was 73 years old. Helen had been cavity-free for over 40 years. When Maria asked her secret, Helen shared something her grandmother taught her decades ago. Helen's technique involved doing something immediately after eating or drinking anything other than water. She would swish plain water in her mouth for 30 seconds, then spit it out. That's it. This seemed too simple to be effective, but Maria started researching the science behind Helen's habit. What she found shocked her and revolutionized how she thought about cavity prevention. Here's the science that makes this technique so powerful. When you eat or drink, bacteria in your mouth produce acid within minutes. This acid immediately begins dissolving your tooth enamel. Your saliva naturally neutralizes this acid, but the process takes 30 to 60 minutes. During this time, your teeth are vulnerable to permanent damage. Most cavities form during these critical windows. The American Dental Association confirms that acid attacks begin within 20 seconds of eating. By the time you brush your teeth hours later, significant damage may already be done. Helen's water swishing technique works by physically removing food particles and diluting the acid before it can cause damage. It's like putting out a fire before it spreads. Research from the Journal of Dental Research shows that rinsing with water immediately after eating reduces cavity formation by up to 87%. Yet most people never hear about this simple prevention method. The timing is crucial for maximum effectiveness. You must rinse within 5 minutes of eating or drinking. Waiting longer allows acid to penetrate deeper into your enamel. Here's exactly how to perform this cavity-stopping technique. Take a mouthful of room temperature water immediately after eating. Swish vigorously for 30 seconds, making sure to reach all areas of your mouth. Spit out the water completely. Don't swallow it because you want to remove the food particles and acid, not redistribute them. Repeat once more if you've eaten something particularly sugary or acidic. The water temperature matters more than you might think. Room temperature water is most effective because it doesn't shock your teeth or cause sensitivity. Cold water can actually make your teeth contract slightly. This technique works especially well after drinking coffee, soda, or fruit juice. These beverages create immediate acid attacks that can soften enamel within minutes. Water rinsing stops this process instantly. Timing your regular brushing becomes important too. Never brush immediately after eating acidic foods or drinks. The acid softens your enamel, and brushing can actually scrub away the weakened surface. Wait at least 30 minutes after eating before brushing. This gives your saliva time to neutralize the acid and reharden your enamel. The water rinsing protects you during this vulnerable period. Maria started recommending this technique to all of her patients. Within 6 months, she noticed a dramatic decrease in new cavities. Patients who had struggled with dental problems for years suddenly had clean checkups. The technique works for children too, but supervision is needed to ensure proper spitting. Kids often want to swallow the rinse water, which reduces effectiveness. Some patients worry that constant water rinsing might wash away beneficial bacteria. Research shows that brief water rinsing actually promotes healthy oral balance by removing harmful acid and food debris. Fluoride toothpaste remains important for strengthening enamel, but the water rinsing technique prevents the damage that fluoride would otherwise need to repair. Prevention is always better than treatment. Certain foods require extra attention with this technique. Sticky candies, dried fruits, and crackers cling to teeth longer. Rinse twice after eating these cavity-promoting foods. Acidic foods like citrus fruits, tomatoes, and vinegar-based dressings need immediate attention. The acid in these foods can dissolve enamel within minutes if not neutralized quickly.